Hello, I'm Kelly, and I'm with the New Mexico Aging and Long-Term Services Department, and I'm the Senior Medicare Patrol Coordinator and Lead Caseworker. And I'm going to talk to you today about preventing Medicare fraud. We will discuss what the Senior Medicare Patrol is, what are Medicare fraud, errors, and abuse, how to protect, detect, and report, how to fight back against Medicare fraud, scams and real life cases of what we're seeing here in New Mexico, and our volunteer program. I'd like to start with the SMP mission, which is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. The SMP is federally funded through the Administration for Community Living, or ACL, and there are SMPs in every state. We receive ongoing training from Medicare, and all services we provide are completely free. Before jumping into providing more details about Medicare fraud and the SMP program, I'd like to provide an overview of the Medicare program. And Medicare is the federal health insurance program created in 1965 for people ages 65 and older, some people with disabilities under 65, and a few others, such as those with end-stage renal disease and Lou Gehrig's disease. The Medicare program was not designed to pay 100% of all medical bills, and Medicare covers over 61 million people. There are two types of Medicare coverage. There is Original Medicare or a Medicare Advantage plan. Both types can have fraud, error, or abuse issues, and both send summaries for review. Original Medicare is through the government, and a Medicare Advantage plan is through a private insurance company. It is important to understand that healthcare fraud, errors, and abuse affects everyone. The loss of Medicare funds due to fraud affects all taxpayers and depletes the Medicare Trust Fund, which means future generations may not have access to Medicare as we know it. These are some examples of Medicare fraud. Billing for services, supplies, or equipment that were not provided. Billing for excessive medical supplies. Obtaining or giving a Medicare number for free services. What is Medicare abuse? Abuse is practices that result in unnecessary costs to Medicare. Some examples are improper coding to obtain a higher payment, unneeded or excessive x-rays and lab tests, claims for services that are not medically necessary, and using another person's Medicare number or letting someone else use your number, misusing codes on a claim, and charging excessively for services or supplies. Now, what about errors? Healthcare services and billing are extremely complicated, which can lead to errors. A review of the issue will determine if it's an error, fraud, or abuse. So most Medicare payment errors are simple mistakes and are not the result of providers that are trying to take advantage of the Medicare system. Sometimes what seems to be fraud or abuse turns out to be a simple error that can be fixed by contacting the provider. It is important to report misused, stolen, or compromised Medicare numbers. Misused means you let someone use your Medicare number fraudulently. Stolen, of course, is when someone steals your Medicare number, and this can be someone that you know. We've seen cases where a family member has stolen a Medicare number of a loved one. And compromised is when your Medicare number is accidentally exposed, like giving it out to a scam caller, any stranger, or a non-provider. And you should treat your Medicare number like a credit card number. And here's what to check for fraud, errors, and abuse. If you have original Medicare, you should review your quarterly Medicare summary notice. And if you have a Medicare Advantage plan, you should review the explanation of benefits, which comes after you receive services. And if you don't receive your Medicare summary notice or your explanation of benefits, you should contact Medicare or your Medicare Advantage plan and ask them to start sending them. And they should come by mail unless you've opted for electronic copies. Consequences of Medicare fraud, errors, and abuse. Medical identity theft is when a Medicare number is misused by a provider or someone posing as a beneficiary in order to receive medical care. A beneficiary whose number is compromised may be affected forever by false claims against their Medicare number. There's a health impact. Receiving care from a fraudulent provider can mean poor quality of care and receiving services that are not medically necessary. You may be denied needed Medicare benefits. For example, some products and services have limits, and if Medicare thinks that such products and services were already provided, they may deny payment. So for example, if your Medicare number is used to buy a wheelchair or a walker, and later on you really need one of those items, then Medicare will likely question it and you may not be able to get the item because they've already paid for one. There can be personal financial losses. You could have co-payments for services that were never provided, were excessive, or were medically unnecessary. And you might be billed the entire cost for services that could have been billed to Medicare. There are 3 steps to prevent Medicare fraud: protect, detect, and report. Step 1 is to protect yourself from Medicare fraud and abuse. And these are some do's and don'ts. Do treat your Medicare and Social Security numbers like a credit card number. Do watch out for identity theft. And do be aware that Medicare will not call you. Don't give out your Medicare number except to your doctor or other Medicare provider. And don't carry your Medicare card unless you need it for an appointment. And always, always protect your Medicare card and ID number. And again, remember, Medicare will not call you. They will send a letter. And do not give your Medicare number out over the phone. And beware of callers or emails offering free medical tests or supplies. Nothing is free. And we recommend that you do not answer calls from callers that you don't recognize. Step 2 is to detect Medicare fraud and abuse. You should always review your Medicare summary notice or explanation of benefits for mistakes. And you should look for 3 things: charges for something that you didn't receive, billing for the same thing twice, or services that weren't ordered by your doctor. And you can access your Medicare information, such as your Medicare summary notice, online at medicare.gov by creating a secure online account. And keep in mind, if you register for online access to your MSN, you will no longer receive the hard copy by mail. And you should keep records of all your healthcare visits. And you can do this by using a healthcare tracker like what you see here on the screen. And we have them here at the conference. If you would like one, just come and see us. And in this healthcare tracker, you should record your doctor visits, tests, or any procedures that you have, and then compare that healthcare tracker to your Medicare summary notice or explanation of benefits to make sure that they are correct. And if you find any charges for services or items that you did not request or receive, you should call us at the SMP at 800-432-2080. Step 3 is to report suspected Medicare fraud and abuse. And the first step here is to call the provider and find out if the issue is a mistake. You should gather all information and documentation, such as your Medicare summary notice, explanation of benefits, and any itemized bills. And you should document all calls that you make, such as the dates, times, and names of who you speak to. And if you're not satisfied with the response that you get, you should call us at the SMP at 800-432-2080. The most common scams that we see here in New Mexico stem mainly from telemarketing or scam callers. For example, compromised ID numbers. This is when Medicare beneficiaries give out their ID numbers, usually to callers that are claiming to be from Medicare, usually regarding new Medicare ID cards, such as plastic, microchip, or green ID cards. And there's no such thing. Medicare is not issuing new ID cards. There are also durable medical equipment scams. And this is when Medicare beneficiaries give out their ID numbers to a caller offering durable medical equipment. Sometimes the beneficiary later receives by mail a DME item, and such as like a back brace or a knee brace that they did not need or want, and their doctor did not order, and Medicare gets billed for the item. There are marketing scams, and this is when free services are marketed to Medicare beneficiaries, such as COVID tests. So the Medicare beneficiaries will give out their ID number to a caller offering free COVID test kits, and Medicare gets billed. Sometimes the beneficiary will receive the tests, sometimes they don't, and sometimes the tests are expired, but they're not free if Medicare gets billed. And Medicare pays $94 for each kit. And I've seen cases where Medicare was billed as many as 10 times for a Medicare beneficiary, and again, they pay $94 per kit. And there are also marketing violations, and this is when a beneficiary gives out their ID number to a caller, wanting them to switch plans and promising extra or free benefits. The beneficiary then gets switched to another plan and as a result loses access to their providers and or necessary medications or treatment such as dialysis. So if you hear of any of these types of scams, call the SMP, and remember, Medicare will not call you. Now I'd like to take a minute to talk about our volunteers. And we could not do what we do without the assistance of our volunteers. They receive national training from our sister program, the State Health Insurance Assistance Program, or SHIP, and ongoing Medicare training. It's a true commitment. We have a small but mighty group of volunteers who are fantastic and are truly committed to assisting the seniors here in New Mexico, and we just love them. And if you would like to join us as a volunteer, please call us. To contact the SMP, you should call the Aging and Disability Resource Center at 800-432-2080. And remember, it is a call center, so be sure to ask for the SMP. You can also contact us by email that you see here. It's nm.adrc@altsd.nm.gov. And you can also contact us by web chat on our website. The website is nmaging.state.nm.us. And for that, you would click the click to chat button that you see here on the screen, and that'll connect to a live person. And we monitor web chat Monday through Friday from 8 to 5. And it's monitored by lovely people, Roseanne, Angela, and Tariq. And there are not automated responses. So you'll get one of our lovely people in real time to answer your questions and provide assistance. You should also call the ADRC to speak with an options counselor to connect you with resources that could be available to you in your community. We also do benefits counseling. So remember to contact us during open enrollment, which is October 15th through December 7th. We provide unbiased information about your healthcare options. And just want to give a shout out to the options counselors at the ADRC. They are total rock stars and are amazing and truly care about serving the seniors and disabled community of New Mexico. So please do call us. And if you want to learn more about aging and long-term services, you can check out our YouTube channel at ALTSD New Mexico State. And there we have workshops, tutorials, and all kinds of good stuff, such as we have a Medicare 101 video, and that is for people who are new to Medicare, and it's soup to nuts what you need to know about Medicare. We also offer the Medicare 101 workshop live, and we do that monthly in real time, where you can ask a counselor any question that you might have about Medicare. The link is on our website, and it's under upcoming events, and there is no registration required. And for the latest news on aging and long-term services, you can follow us on Facebook, Twitter, and now Instagram as well. And we ask that you please take our SMP presentation survey, and that helps us to improve our outreach that we do. And it's completely anonymous, and there's only a few questions. It only takes a few minutes, and you can see the link here at surveymonkey.com. And this is where you can let the feds know how we did today. And in closing, remember there are 3 action steps to prevent Medicare fraud and abuse: protect, detect, and report. Protect your Medicare number like a credit card number. Detect fraud, errors, and abuse. Report any potential issues to the SMP at 800-432-2080. And remember, that is a call center, so be sure to ask for the SMP. And I would like to thank you for your time and for being with us today. And we're happy to open it up and take any questions that you might have.